Right now is Eating Disorder Awareness Week, and during this week, there's a bunch of organizations that are really working to bring awareness about the complexities surrounding this. Joining us today is Dr. Elizabeth Wassenaar. She's a psychiatrist who specializes in eating disorders. I wanted to just start off with body dysmorphia. What is the actual definition of it? I feel like a lot of people have an idea of what it is, but what is the actual clinical definition?
Absolutely. So body dysmorphia is a mental illness that's characterized by a unreasonable focus on a specific component of the body. It can be associated with eating disorders, but is not always associated with eating disorders. And we consider it to be part of the OCD spectrum of illnesses. So it's an anxiety-based disorder.
You know, I think people sometimes use that phrase a lot in everyday terms. Like, how do you know that it is something that needs to be maybe addressed with your doctor?
So just like any mental illness, when the symptoms of the illness end up impacting someone's ability to function in their life, we consider that to be a time to seek help, ask for help. So when they're not able to do things that are important to them, like attend family gatherings or go to school or work because of their concern about their body size or shape or another component of their body, then that would be something you'd want to talk to a doctor about.
You know, I think a lot of people might feel a little bit alone or isolated as they're going on this journey. How many people is this truly impacting?
That's such a good question. And the reality is that we don't know the exact numbers because it is has so much shame associated with it. And it is such a hard thing for people to identify. As you've identified as well, it's sometimes conflated with an eating disorder. So the true occurrence of body dysmorphic disorder on its own is not truly known.
Wow. When it comes to your friends and your family around someone, what should they be looking out for?
So we want to notice when somebody has dramatic shifts in their ability to participate in their daily life or has significant mood shifts, if they are avoiding things that are important to them. And if you're worried about someone, we encourage you to approach that person with compassion. Let them know you're worried about them, you love them, you care for them, and you really want to see them get the help they need.
What is a good starting place for someone who's reaching out for help? Is it your family practice doctor? Is it a therapist? How do you go about that?
Absolutely. I think that all of those professionals are good resources. So you don't have to find the exact right resource. Asking your family practice doctor, your pediatrician, your school counselor or nurse, all of those people, or looking online for resources as well. To Google these things, you can find national organizations that have support options for families and people struggling with these disorders.
Well, thank you so much for coming on to talk about such an important topic. We really appreciate it.